So tonight, my topic here is called fatty liver. Fatty liver. So you can see our liver. First, how many kg of with this what we say called human liver, yeah, adult human liver. In fact, according to the research, is 1 to 1.2 kg, 1 kg to 1.2 kg. Yeah. So during night time, yeah, the clock, 11 p.m., it will start working. Okay, so it will ingest a lot of blood into this liver. So it will expand 2 to 2.5 times expansion. So when you sleep, you must sleep in the right position, we say. So some people just sleep, the face down, and most of us sleep probably sometimes say on the left, turn to the left, or sometimes turn to the right. People say turn to the left, probably you feel that your heart is like you are pressing towards your heart. You feel uncomfort. When you are going to the right, your liver is on your right. So which way you sleep is the best? Well, best is face out, yeah? Best is face out. Then you can have the space for your liver to do the work because liver doing expansion 2 to 2.5 times. So you can see this picture here, fatty liver. We say using this microscope. I don't know how many times of power of it. So you can see these fats inside our liver. Fats inside our liver. So healthy liver is so clean and beautiful, and fatty liver, well, you can see a lot of fats there. Okay, fats there. So is fatty liver a small problem? Ask yourself. It's so common now. Is it a small problem? Well, some people say yes, some people say no. Well, healthy liver become fatty liver, then you will go into more serious case, probably cirrhosis or say liver cancer. Then it is will take our life. No. So what is fatty liver? What is fatty liver? Fatty liver, also known as hepatic steatosis, is a condition when too many fats cells accumulate in the liver. What are the fats accumulate in the liver? I write down here. First is triglycerides, phospholipids, glycolipids, cholesterol. Okay, during a blood test, I believe you know what is that. Okay, so probably people say, oh, my LDL is too high, my triglycerides is too high, So what should I do? What should I do? So this condition can occur when your body is producing too much fat or not being able to metabolize them properly. So according to the research, it's okay if the fats contains with these triglycerides, phospholipids, glycolipids, and cholesterol is around 3%. Anything more than 5% is considered as fatty liver. Okay, fatty liver. Anything more than 5% of fats inside your liver is considered as fatty liver. So types of fatty liver. This is what we need to learn about. When an alcoholic person gets fatty liver, it is known as alcoholic fatty liver disease. So it's AFLD, alcoholic fatty liver disease, AFLD, so short form. So one who doesn't drink and develop fatty liver is known as non-alcoholic fatty liver disease. So put an N in front, so it's none. It doesn't mean that when you drink alcohol, beer, or any liquor drink, then you will get this fatty liver. Even though those who don't drink, they may got this called NAFLD, yeah, non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease, why is that, right? So it's a term for a range of conditions caused by buildup of fat in the liver. It's usually seen in people who are overweight or obese. Okay, so you can see some fat people around us, especially we say Southeast Asia, more Southeast Asia, Malaysia, on this adulthood or even children, we are number one. Yeah? Malaysia is number one in obese, okay? The country in obese. So a healthy liver should contain little or no fat. It cannot be no fat. Just now we talk about triglycerides, phospholipids, cholesterol, yeah. So we talk about it already, yeah. So definitely there will be some fats. So it's estimated up to 1 in every 3 to 5% has early stage of non-alcoholic fatty liver disease, where there are small amount of fat in their liver. So early stage on NAFLD does not usually cause any harm, but it can lead to serious liver damage, including cirrhosis, if it gets worse. Okay, so having high levels of fat in the liver is also associated with an increased risk of serious health problems, such as diabetes, high blood pressure, and kidney disease. So this we call fatty liver will, increase risk of other serious health problems. So it's related, so diabetes, high blood pressure, and kidney disease. So it doesn't mean that fatty acid only cause the liver damage. Yeah, it may relate to other disease. Okay, it may bind to other disease or link. Yeah, so if you already have diabetes, so NAFLD increases your chance of developing heart problem. Now it's talk about heart problem. So this means that any person who is diabetes, so they develop into heart problem. So diabetes patient doesn't mean that they are AFLD. Yeah, it's not alcoholic drinker. He or she already a diabetes. That's why he got this fatty liver. Yeah. So if detected and managed at an early stage, it's possible to stop NAFLD getting worse and reduce the amount of fat in your liver. So the research then saying that anyone who have this fatty liver, get it done as soon as possible before it get worse. Get worse means it go into like cirrhosis stage or liver cancer stage, then no reverse anymore. Means our liver can't recover anymore. I remember I talked about my friend in Johor Bahru who had this liver problem, liver damage. The surgeon cut off 700 over gram of his liver. Yeah, but after that, now the liver fully grown back. Okay, so amazing. Yeah? So if detect early stage, still can manage to really reverse and make your liver go into healthy stage. Yeah. So actually, in fact, last time previously, doctor said he probably live around maximum around 6 months, but he already I think extra around 10 years already now. Yeah, extra around 10 years already. So amazing, yeah. So the main stages of NAFLD, in fact, There's called GNM1, stage 1, 2, 3, 4. Yeah. So simple fatty liver steatosis are largely harmless buildup of fats in the liver cells that may only be diagnosed during tests carried out for another reason. It may be due to certain kind of sickness, then you go for a blood test, then find out that, oh, got fatty liver. Yeah. So non-alcoholic steatosis, hepatitis, okay, NASH, that's called NASH, okay. This is same as NAFLD. So a more serious form of NAFLD where the liver has become inflamed. So this means that NASH is already, the liver already having inflammation. The inflammation takes place. Yeah. So we call as NASH. Yeah. So another one is fibrosis, where persistent inflammation causes scar tissue around the liver and nearby blood cells, blood vessel. Okay. But the liver is still able to function normally. Why? In fact, liver, they don't have this called nerve for, they call it as a 痛感神经. I forgot to search for these English words. Someone may help me. Liver doesn't have this called to detect on this pain until on the last stage, then only feel pain. So that's why anybody who have liver problems, it's just a sign of, in fact, it's actually no sign at all until very serious stage, then only have some sign coming out. Yeah. So the fourth one is cirrhosis, the most severe stage, occurring after years of inflammation, where the liver shrinks and becomes scared and lumpy. This damage is permanent and can lead to liver failure, where your liver stops working properly and liver cancer. Okay, so these are the 4 stages of NAFLD. Okay, so let us talk about increased risk of NAFLD if you, okay, if me, okay, obese or overweight. If we are overweight, particularly if you have a lot of fat around your waist and apple-like body shape, so anyways on we call 80 centimeter for the ladies and 85 centimeter for men, that's called obese. We call obese. So have type 2 diabetes, and then third one have high blood pressure, fourth have high cholesterol, have metabolic syndrome, a combination of diabetes and high blood pressure and obesity. 6, over the age of 50. Oh my goodness, I'm more than 50. So smoking is not alcohol, because we still talk about NAFLD. So you can see these 7 lists here, listed here, is increase the risk of non-alcoholic fatty liver disease. So if obese, type 2 diabetes, high blood pressure, high cholesterol, metabolic syndrome, over age 50, and smoking. What are the causes of fatty liver? Some of the most common causes of fatty liver are obesity. This is very common. Yeah, when you are, or you and I, aging stage. So we may have this called build up, especially on waist. When an individual reaches up to actual weight of their body according to height and other aspects, the condition is called obesity. This can also occur due to other reasons like inactivity. This means lack of exercise, consuming too much of carbohydrates food. This is what we like. Normally Asian, Southeast Asian country, normally we like. So obesity waist measurement for male is 80 centimeter, female is 85 centimeter, equal obesity. So insulin resistant. So this is very, the words that come to us, insulin resistant, is when we do our 18672 light detox program, light fasting program. So the words come to us is insulin resistant. 胰岛素阻抗 or 胰岛素抵抗 Improper response to the insulin of the body causes the increased level of glucose, such as a condition is known as insulin resistant. So insulin resistance can be caused due to different reasons like diabetes, PCOS. What is that? It's female. Normally talk about ovarian one. PCOD, same, but it's more serious case on talk about ovarian. So, and obesity. So these are the causes of fatty liver. And high blood sugar. It is the high level of insulin in the blood, which differs from type 1 and type 2 diabetes. High blood sugar doesn't mean that already really a diabetes patient, not yet. Properly found out that the blood test, then the sugar level is high, but it's not a diabetes patient yet. So high level of fat, those who consume high fat concentrated food, okay, or have inherent high levels of fat can result in it. So these are the causes of fatty liver. Okay, some of the less causes of fatty liver can be, very less common one can be due to pregnancy, or certain genes raise the cause of fatty liver, and exposure to some toxin, and then properly rapid weight loss, some types of infection, bacterial infection or virus infection properly. So what are the symptoms of fatty liver? Now we talk about symptoms. There are no particular signs of fatty liver through which one can detect fatty liver, but many people experience fatigue and abstract pain in their lower abdomen. When there is a pain, normally it's quite serious already. Yeah. Okay, so what is the diagnosis for fatty liver? You see, I Google search this, and this is talk about scan, CT scan. Okay, generally doctors follow the below mentioned step to identify if someone has fatty liver or not. Doctors will ask you about your medical history. This is very common. So they can also examine patient physically to know if they are swell. The liver swell up means abdomen swell up, especially on the right side. The blood test can also review about individual condition. Later we talk about liver test on blood test. I will study through it with you. This is a special part that we need to know from your blood test report. If you have it, you get ready your blood test report. Okay. So imagine study like CT scan, ultrasound, exam, and MRI scans. So these are the scan. You can see whether your liver having these facts or not. Sorry, I'm not a medical profession, but I roughly know about it because I watch a lot of these medical videos every now and then. I've been watching this all this while. For long years, I'm watching this medical video to get to know. I want to be a doctor, but I can't be. Okay. My youngest uncle is a medical doctor. He's a scientist. So another one is liver biopsy. According to medical profession, liver biopsy is the most accurate to talk about whether it is having fatty liver, or maybe other like whether the liver is inflamed or cirrhosis stage. So okay, we learn together. So what does it mean if ultrasound show fatty liver? Now we talk about ultrasound. There are many causes of fatty liver consequences. It may be due to metabolic diseases, heavy drinking habits, nutritional disorder, or drug use. Okay, let us talk about nutritional disorder. What does it mean? Means imbalanced diet. You see, sometimes we don't know. So because I've been asked a lot of questions about this sickness, that sickness. Today I'm quite busy, but luckily not so many questions. but there are few, but I can manage it well. Well, you see, sometimes imbalance of nutrition also having problems. Yeah, of course, drinking is worse for the liver. If every day drink, from what I know, if you drink a can a day, probably down the road 10 to 20 years, the liver will already inflamed. Already inflamed. So in fact, to determine whether it's really fat or not, it is necessary to pass blood test to check whether liver enzymes are high based on indicators of SGOT, SGPT, and GGT. So I believe you know about ALT, AST, same thing. Talk about SGOT and SGPT, and then GGT. So from your liver test, if you have your liver test report, take out your liver test report, then you know. The most accurate way is by biopsy, like what I said just now, of liver for microscopy to calculate the percentage of cell containing fat particles. You see, so biopsy is the most accurate. Depending on the severity, the doctor may give you additional tests such as CT scan or MRI or hepatitis B to C test. Yeah. So this is the blood test report from my blood test report. Okay. From my blood test report. Yeah. Just to show you, this is my blood test report. Okay. To show you. So, well, you can see we have this called liver function test. We have total protein, we have albumin, globulin. If you have this, we call albumin or globulin high, it may be a sign of your liver or kidney or maybe some infection. Okay? This is the study. Even the AG ratio high, also same thing. Yeah. And if talk about total bilirubin, maybe liver disease, maybe due to medication or maybe disorder of the red blood cells. If disorder of the red blood cells, we need to study about the ESR. We need to study about RBC or hemoglobin. That's why all the blood test report are related, no? Related. So we have to go into one by one. Yeah, because I see many blood test reports, so I'm not expert, but I know. Yeah. So, and then we talk about alkaline phosphatase. I hope my pronunciation is correct. Okay. It's very difficult to pronounce. Alkaline phosphatase. It's due to liver or gallbladder. Probably there's a blockage, there's a stone, gallstone or cirrhosis or even liver cancer or hepatitis. So then if this is quite high, doctor may ask you to go for another test, more test. So, and then we go into AST, ALT, SGOT, SGPT, GGT. This is normally what I see on patients who have quite serious sickness. If their SGOT, SGPT, and GGT are in the good manners, good normal condition, then the chances for him or her to recover from his or her sickness is very much higher, the chances. If the liver, SGOT, SGPT, GGT, the level is not normal, is too high already, then, like for example, SGOT exists 40 here, different lab tests maybe having different calculation, different kind of calculation. Like just now I mentioned here, is talk about biopsy, is talk about percentage, you see. So it's a very different, this is talk about different kind of levels, test. So ALT is if more than 53, like GGT less than 73, but it's already more, too much sometimes. Then we have to see what is happening. And then we can go into another one, is called neutrophil, lymphocyte, monocyte, eosinophil, and basophil. If you know about it, then you know about what is happening to the immune system already. Yeah. So When people having SGOT, SGPT, GGT too high, we know that he's probably having the we say fatty liver, and sometimes when I study, when I see their hemoglobin, RBC, or especially this called EXR, ESR is too much higher, meaning that the blood stickiness is there already. So I know roughly from the blood test report, we know that what is happening to this person. Okay, so I hope you learn something from here. Yeah, I tell you the truth. Not easy, yeah, to learn blood test report. So sometimes you have to go to even talk about reading. Is for example, alkaline phosphatase is too high already. Then probably there's a test called CA 19.9. I think you know. This is talk about pancreatic cancer test. And then CA or certain type of different kind of cancer tests, CA. And then another one is called PSA. PSA is for male. Normally it's talk about prostate, whether having inflammation or cancer. Okay, and another one is called CA125. CA125 is for ladies, normally talk about ovarian. Yeah, probably, well, is it having cancers or what? Yeah, this is the different test. So you know that from your blood test report, yeah, you can see that everything is written here very accurately, but yeah, correctly, yeah, correctly. I hope you see. Yeah. So okay, another one we say ultrasound. Ultrasound result fatty liver. So fatty liver is a condition in which liver cell accumulate 5 to 10% more fats of the liver. So just now in the beginning, the first page, the second page, I already talked about how much what we say fat lipids or fats in your liver. So it's around 3% there. So anything more than 5% is fatty liver. So that 3% is talk about triglycerides, phospholipids, glycolipids, and cholesterol. Cholesterol. So that's why we test from SG, OTS, CPT, GDT. We know what is happening there in your liver. Yeah. So to determine whether the liver is fatty or not, it must be calculated based on measurement of the liver. Sometimes the liver will really, I don't know, normal size, but it's already like swell out, swollen. We say swollen. So the doctors know how, from the scan, they know and see the check on it. Yeah. So they check on it whether the size is already too much, because I have been seeing too many reports. Like last month, I saw one report. Wow, amazing! But she is lucky. Luckily, didn't go into serious stage. So luckily, she met in Chawei leader, and then the leader provide her our products, and within the 3 months time, everything go back nearly to normal. 3 months only. Amazing, yeah? Amazing. But really need to control the food really, really well. Yeah. So what are the early signs of liver damage from alcohol? Now we talk about alcoholic fatty liver disease. General symptoms of alcoholic liver disease include abdominal pain and tenderness, dry mouth, increased thirst, fatigue, jaundice, which is yellow of the skin, loss of appetite, and nausea. Not only yellow of the skin, sometimes you can see from our eye, the whitish color, it turns to yellow. We know that it's a kind of liver disease already. So including abdominal pain is really a sign. Sometimes you don't know what is happening. You always, after your meal, you feel uncomfort. You feel you want to vomit. You feel that you are not in the mood of eating, yeah, and always feel very tired. then you better go for a good blood test or consult doctors. Yeah. So your skin may look abnormally dark or light. Your feet or hands may look red. Okay, your feet and or hands may look red. That's why when I see some people pump, pump, it's really pinkish color. We say. That I remember, if I'm not mistaken, should be before MCO. That was nearly two and a half years back. During NDO time, I saw one of the men. I said, "Oh, your palm is so it's not just red, it's like pinkish red." So I know that his liver is in trouble. So that's why I give him some advice. So swelling of your liver, which may lead to discomfort in the upper right side of your abdomen. So our liver is on the right side. So we know that we must really, what happened when feeling something like you touch on it, you feel like swollen, or you feel, because the liver doesn't, during the early stage, it doesn't have any pain at all, because they don't have what we call 痛感神经. I forgot to search for this English words just now. Fatigue, if you're tired or unexplained weight loss or loss of appetite, these are the signs of liver damage from alcohol. Yeah, so we get to know about it. Yeah, so sometimes when you promote your products, or some people say, I got this problem, that problem, probably you learn something from tonight's topic, then you can really be give a good advice to him or her. Yeah. So even nausea and vomiting, that's how I already mentioned about it. Yeah. So okay, what are the treatment for fatty liver? What are the treatment? Yeah, to your knowledge, what are the treatment? According to health website Healthline, there are no such medication that have been approved to treat fatty liver. But here are some of the treatment which are prescribed by doctors. Doctors say limit or avoid the usage of alcohol. So there are no medication. So how? So ask you to limit or avoid the usage of alcohol, changing eating habits. So eating habit means no fried, oily, grilled food, no oily food, no good food. I say no good food. Okay. So any daily living habits, always sleep early. Yeah. And then reduce your stress, tension. These are the important things, and do regular exercise and drink enough warm water. Yeah, I say warm water, not cold ice water, cold water. Right? And then if obese, weight loss, that's the best to reduce. So our 18672 light fasting program is very successful. Yeah. So probably during Chinese New Year we have another session on it. Yeah. Okay. Stages of liver disease. So healthy liver, fatty liver, fibrosis, and cirrhosis. Just now we already talked about this different kind of stages of liver problem, liver disease. So okay, liver gallbladder detox. Now we talk about liver gallbladder detox. Previously before this 18672 light fasting program came up from this Inchaway company. So I do liver detox, liver gallbladder detox. Every 6 months I do that. Yeah. So in fact, gallbladder detox is super good, but more intense more than this 18672 light fasting program. So probably after the MCO, we say have the company suggest the company we will do one more time after the MCO to do this liver gallbladder detox. So the gallbladder detox is responsible for storing the bile. The gallbladder is responsible for storing the bile that the liver makes. So liver makes the liver, we say acid, that's stored in the gallbladder. Okay, so the fruit can help you digest fat more effectively. While the gallbladder helps with digestion, you don't need a gallbladder to live. So you don't need a gallbladder to live. Anyone that you come across that you know already removed their gallbladder, I believe a lot of them are having this, we say gallbladder stone. If when the stone is too big and then causing them big trouble, always pain here and there, doctor say, hey, remove your gallbladder. So anyway, without gallbladder, you still can live. Yeah. So gallstones are hardened deposit that can develop in the gallbladder and cause pain, nausea, and vomiting. If they block one of the gallbladder, that one is in big trouble. So in fact, according to the research, the adults, we have 500 to 800 crystals in our body. So the thing is here, how to get rid of it. Yeah, best is still doing this we call liver gallbladder detox. So this, the picture here, you can see the clean, healthy gallbladder, and then it's having some stone. The scary part is this blockage about that by gallstone. This one need to go operation. If you get to know early, properly through liver gallbladder detox, it can remove it. Yeah, there are a lot of what we say the nutrition study or dietitian, different kind of normal what we say remedies to use to help to go for this gallbladder, liver gallbladder detox. So our in way we had done it 20 over times, in fact, very successfully done. Okay, so liver gallbladder detox, if anyone diagnosed with gallstone, there's a potential way to remove them naturally without surgery. This is what the research done. So depending on the size and severity of your gallstone, the gallbladder flush and liver cleanse can help your body pass the gallstone safely and effectively. You see, the crystal, the stone, yeah, how to really make it soften and really discharge it off from our body. That's important. Yeah. So you see the stone, yeah, 0 to 2 cm here. The gallbladder organ is so small, okay, but the stone is so big. What do you think? Will cause you pain or not? Definitely. Correct or not? So when the stone is accumulated inside your gallbladder, definitely will cause pain. So if too big, too much of too many of stones inside the gallbladder, so when you see the medical doctor, yeah, profession, they say you got to remove it. Yeah, if not, will cost you life. Maybe, yeah, it may be. Yeah. So okay, so these are the stone. So it can remove. So I remember I do few times, always having some discharge of some crystal stones from my body. Yeah. So the research done is like that. If it is the stone came up from your body, if it is a reddish color, okay, is from your heart. It's from your heart. Okay. And if white one is from your lungs. If what we say gray and black is from your kidney. Okay. And then if yellow green is normally from your gallbladder or maybe from your stomach. Okay, so different kind of colors from your different kind of organs. Yeah. So these are the picture that you can see from here. The stone inside the gallstone is this is too much. So there's a stone here inside the ducts here, common bile duct. It will fall through and then stuck there. That definitely will cause serious pain. So need to go for surgery. So doctor say, hey, remove it. That's it. So after remove it, normally doctor will tell you not to eat any oily food. Is it correct? Definitely is correct. But our body need omega-3 and 6. How? How? The next question is how? So we need it. But if you already remove the gallbladder, normally such person definitely they have this, which we say digestive tract problem. Digestive tract problem. Normally they will get easy to get this we call diarrhea. Definitely. Yeah. So that's why any food that they take, no oil, cannot. We need omega-3, 6. So I suggest you to take sacha inji oil, which have high omega-3, and then together with chaga. Together. So this is a solution that to help you to really solve some of this, we say, fatty liver. So we use a good oil, take good oil in, bad oil out. That is the better way to discharge off this, we say, bad cholesterol, triglycerides, or any kind of bad oil inside your body. Or we say maybe trans fat. Trans fat is not easy to get it out, but it takes time. Well, if you take enough such an oil. Some people say, I take one is enough. I say, when you eat one piece of chicken wing, chicken drumstick, or chicken breast, fried one piece of it contains 15 ml of bad oil. So one packet of such an oil and one piece of fried chicken, 15 ml bad oil. So is it enough to help to discharge all the bad oil from your body? Definitely is not enough. Okay? And most of people having high cholesterol, high bad cholesterol, LDL high, also triglycerides, and probably having high blood pressure also, probably having diabetes also. So sometimes they say one sachet can solve the problem. Sorry, my words, my answer is say no. Yeah. So sacha inji oil, this is our first key product from Sacha Way Company or Incha Way Company. So it's really safe. Yeah. And the ingredient we say inside this packet contains of omega-3 43%, omega-6 40%, okay, and then with omega-9 also, and vitamin A and E. So it's really safe. We assure you that we don't have this cholesterol contents or trans fat contents, or we say non-GMO, and even the plasticizer, the packing is food grade also, because when you sip, if the packing grade is lousy, with toxic, then it will cause you toxic also. So definitely ours is without plasticizer, and then in our quality also doesn't contain any pesticide. And we have this 10 million ringgit product liability insurance. You see, fertilizer free, and then what else? Pesticide free, mentioned already. And then a low acid value is below 1, meaning that it's very and it's halal. So with 10 million ringgit insurance. And how many packets you want to take? First, normally I say 1 sachet a day first. The 4th day onward, 2 sachet after meal. And then followed by 8 days onward, 3 sachet, or maybe morning breakfast, after morning breakfast, 2 sachet, and then another 2 sachet in the after dinner. So next products I introduce to you is I say it's rich. Rich. In future, our name here is called rich because of what we say not approved using this rich. So last time can, now cannot already. So I don't know why. Yeah. So rich, which contains of, we say, squalene. And we talk about squalene first. Squalene first. What is squalene? In fact, if you know about the history of the shark never have cancer in the history before. You see, the big shark live in the deep sea. I don't know, probably 100 meters, 500 meters, or 1,000 meters. That one is with very, very minimum oxygen. They can live there, they can swim there, without any problem. So, in fact, shark liver contains squalene. But our squalene is from where? From rice bran germ oil. Okay, rice bran germ oil from the earth. Okay, not from the sea. So vegetarian can eat. So squalene helps. You can see the picture here. Supply oxygen, activate cells. So squalene hypoxia stage of the body cell means the cell itself lack of oxygen. So it can help to improve and with like supply oxygen or activate our cells and can timely deliver oxygen to the cells and activate the body functioning cells. Okay, so strengthening and protect the liver. So enhance liver function, promote the bile secretion, increase appetite, and have a good effect on treating hepatitis. So these are the liver function. So promote intrahepatic fat metabolism. So the answer is already out. Regulate blood lipids, reduce the amount of fat in the liver. Thus, it can help treat fatty liver and help people who eat a lot of greasy food to restore normal levels of cholesterol in the blood. Wow. You see, this is squalene, the ingredients from the rice bran and germ oil. Another one is purify the blood. When we have sticky blood, when our blood is dirty, we say full of toxic, full of rubbish inside our bloodstream, we have to purify our blood, promote blood circulation. When your blood is sticky, can your blood circulate well? Can your blood really, does blood cells having good enough is oxygen levels? Definitely not. So that's why we need to cleanse it. So improve the condition of heart disease, high blood pressure, lower blood pressure, low blood pressure, not lower blood pressure, low blood pressure and high blood pressure, and other diseases caused by poor blood circulation. So squalene, it helps a lot. Okay, rich also contains of oral value 72,000. The test, you see, compared to many different kinds of fruits that we eat, like blueberry fruits, antioxidant oral test is 6,500. Pomegranate, 10,500. Mangosteen, 22,500 is quite high. Goji berry, 30,000. Acai berry powder is 30,000. Okay, but this oral test on rich is 72,000. So high antioxidant can delay aging. So that's why when you take, you will make yourself younger also. So and then promote this balanced immunity. So if we have this called antioxidant, high antioxidant, then easily we say destroy this free radicals. Yeah, free radicals is the one cause a lot of problem in our body. Yeah. So okay, gamma oryzano. A lot of people don't know why is that also. Okay. So one of the nutrients needed by our human body. So improve sleep quality, reduce endocrine disorders, increase insulin sensitivity, reduce blood sugar level. So those who have high sugar level or blood diabetes, yeah, patient, it will help. Okay, so regular blood lipids and bad cholesterol. So another good news for those who have high blood pressure or fatty liver. So improve mental disorder symptom. So these are the main function. So you can see, compare, and then we say this rich contains of 24,733 milligram per kg. It is called per kg. Phytosterol content of rich, very, very high. But in fact, sacha inchi oil also contains phytosterol, but it's only 1,000, quite low. So rich is very, very high. So another one products we have to call balance. Balance. Balance is from macadamia oil and then the sacha inchi oil mix. Mix. So promote to help on support of heart health. In fact, omega-3 can do that. Support insulin sensitivity. Just now we already mentioned this or gamma oryzano can help also. You see, so omega-7, which from balance can support insulin sensitivity, improve satiety, and then improve skin health, reduce inflammation and swelling, support normal cholesterol level, reduce heart disease risk, and then reduce metabolic syndrome. You see, these small words are 1, 2, 3, 4, 5 to 7, 8, 9 to 13, 14, and then to 18, 22. These are the reference. You can search from the net. You can search from the internet, or you can Google search also. Balance, which contains macadamia oil and sacha inchi oil. The strong point is talk about palmitoleic acid. That's omega-7. Yeah. So this is our rich and the sacha inchi oil, which we don't have it at all. So better if you can consume 3 types. Like me, I did that also. I anyhow like to consume. So one day I took 4 packets because I have a family history of cholesterol levels, but my control is good. Okay, so I finish of this session. Thank you for listening. I hope you like this session. I hope you learned something from this session. So